I'll start by mentioning just a few words about the application of telehealth and telemedicine in stroke thrombolysis, which we have embraced perhaps recently at the Brighton end stroke thrombolysis via telemedicine, providing 24/7 service, consultant-led service with stroke specialist nurses on the ground since May of last year. At the other end, at Princess Royal Hospital, Hayward, in our stroke unit, we've embraced the service just since December last year. But the impact so far, although we haven't got a whole year cycle of data to show to you today, but the experience so far has been very good, if not excellent. There were some short-term benefits and long-term benefits that we're already seeing at this point in time. Just to mention one brief thing about the short-term benefits, that the Brighton Hospital, when they looked at the patient thrombolyzed, in particular patient thrombolyzed with the telemedicine approach, there's been, at this point in time, significant, over 10 months, significant reduction in the lengths of stay in patients who are thrombolyzed. The patient who thrombolyzed stayed in hospital 8 days compared to those who were not thrombolyzed, who stayed 14 days in hospital. So there is a significant reduction in length of stay in Brighton. The same applies to our unit. As I said, although we started in December, but the figures that we have collected, we have thrombolyzed since December about 22 patients, but out of those, 3 have been thrombolyzed with telemedicine, and in those 3 patients, the outcomes have been good, and the length of stay again has reduced. The average length of stay for thrombolyzed patients 7 days compared to 16 days in those who are not thrombolyzed. So there are immediate short-term benefits of these applications, and I think the applications for stroke patients in terms of thrombolysis using telehealth and technology is not just for the stroke patients. It is for the stroke patients, their carers, and an important aspect is the quality of life that I'm glad to see today, that the quality of life parameters, the well-being is a major factor in our assessment of the outcomes of these interventions. And just coming today, I've been enlightened by the applications, and it's been an eye-opener for the various ways that we can embrace this in stroke patients in primary care, raising awareness for risk factors for TIA patients, transient ischemic attack, mini stroke patients, for patients as soon as they leave hospital, long-term impact on monitoring and assessing their blood pressure, their cholesterol levels, their diabetes, their warfarin monitoring, their antiplatelets, the drug monitoring. So I can see lots of examples where telemedicine has got, telecare has got lots to offer in supporting these patients in acute setting, rehabilitation setting, and long-term for patients and carers, as well as in research. And I've seen several examples, perhaps not in particularly our region, but for example in Oxford, where they have used the model of telecare in terms of intensive blood pressure monitoring to prevent a second stroke. So what I've come out today, I was given 4 E's, and the E's are not ecstasy, I hasten to add, but I think today's session has been educational. It's given me empowerment to go and spread the message, enlightened me, and for me personally, I think it's eradicated in my mind some myth about and misconceptions about in my mind, the limited applications that we can use. I can hopefully go out of today's thinking about several uses of telehealth and telecare in stroke patients and patients with several cardiovascular risk factors. The questions that came into my mind as a clinician, an academic, and a researcher is that how do we measure the benefits? So the 5 E's that I need to think about are the efficiency of these interventions, evaluation, coming up with the evidence-based medicine, so the health economy, so this is the 4th E, health economy, and the quality of life and the cost-effectiveness model, plus the engagement. So I think an important element in engaging the public and patient initiative involvement is very important in embracing this. And Hazel mentioned raising awareness, so we need to get our participants, patients, carers, involved in this approach. So I think at this point in time, telehealth and telecare, it's all around us, and we cannot deny that fact. And I'm just reflecting on just last week, my wife bought my son an iPad, so he's already using it. I haven't got one yet. Tuesday morning, I went into hospital doing my stroke ward round. The first patient I saw was a patient who was thrombolized with good effect, return of power back to normal, thrombolized overnight using telemedicine. And not just that, last week I saw The Best Exotic Marigold Hotel, which is a fantastic film. Go and see it. But I'm remembering it now. There were two examples of positive and negative portrayal of embracing telecare in older people. One woman and her husband they're retiring, they want to go and buy a new house, and the estate agent who was showing them around the place, he was showing them where the position sensors are, and the woman was very cynical, the wife was very cynical in the film. She said, what happens, because the position sensors were just on the walls, she said, what if I happen to have a fall in the middle of the lounge and I can't reach that? What happens if I have a fall outdoors? Will I have this? So the cynicism and the misconceptions of the limited use of application. But there was a positive portrayal of Judi Dench in the film towards the end of the film. I don't want to spoil the plot for you, but how she embraced use of technology and using the new technology in communicating with her family and with her son. I will finish just by mentioning that as my role in the Surrey and Sussex Comprehensive Local Research Network in Surrey and Sussex, we have embraced this as well. And there were some flyers for our next annual meeting on the 2nd of May in Eastbourne. And as we planned it, this was even before I came to know of this, the last session we have on that meeting is on telecare and assisting living technology. We have some colleagues coming from Cheshire to talk to us about their applications and use of it, to discuss it with researchers, clinicians, patients and public involvement representatives. So I think that the message today that telecare and telehealth is here to stay with us, and as Hazel said, we just need to embrace it and embed its use in our day-to-day practice and thinking about how to use it as a routine and not as something that it is an outsider or something that is totally novel and we don't want to include it, because we're already using it, but we need to use it more effectively, more efficiently, engage with it and be informed with it. Thank you very much.
Thank you.